A ChiroSecure research update. A study published in the Journal of Manipulative and Physiological Therapeutics documented the potential role of maintenance chiropractic spinal manipulation to reduce overall pain and disability levels associated with chronic low back conditions after an initial phase of intensive chiropractic treatments. 30 patients with chronic nonspecific low back pain were separated into two groups. The first group received 12 treatments in an intensive 1-month period, but received no treatment in a subsequent 9-month period. The second group received 12 treatments in an intensive 1-month period and also received maintenance spinal manipulation every 3 weeks for a 9-month follow-up period. Pain and disability levels were evaluated with a visual analog scale and a modified Oswestry questionnaire, respectively. For both groups, the pain and disability levels decreased after the intensive phase of treatments. Both groups maintained their pain scores at levels similar to the post-intensive treatments throughout the follow-up period. For the disability scores, however, only the group that was given spinal manipulations during the follow-up period maintained their post-intensive treatment scores. The disability scores of the other group went back to their pre-treatment levels. This study suggests that maintenance spinal manipulation after intensive manipulative care may be beneficial to patients to maintain subjective post-intensive treatment disability levels. Further studies, however, are needed to confirm the finding in a larger group of patients with chronic low back pain.